I wanted to introduce you to my friend, Charley McMahon. Charley is a young lady that I met. I want to read a letter from her mother. Ladies and gentlemen, I'm writing today to ensure that my 3-year-old daughter, Charley, she's since turned 4, has access to the medical care she needs as a child fighting cancer, and to why the Affordable Health Care Act being revoked would be detrimental to my family. We are your average American middle-class family. We have 2 daughters, ages 7 and 3. My husband and I both have good jobs and own our home in San Diego. On June 28, 2016, we heard those words no parent is prepared to hear: your daughter has cancer. Charley, our healthy 3-year-old, had been diagnosed with leukemia. Sadly, after the initial shock of this diagnosis, my very next concern was, I hope our insurance covers this. Her medical bills over a 6-month period have reached $250,000, excluding prescriptions and daily medications. That's the equivalent to 3,000 tickets to Disneyland, 2,000 lift tickets to a local ski mountain, 233 plane tickets to visit our family in Ireland. My husband work for small businesses that are not required to offer employer-sponsored insurance. We purchase our insurance through the California Health Exchange. We are currently enrolled in a SHARP HMO program. We are limited to which insurance plan we can purchase, since her care can only be provided by specialists at Rady's Children's Hospital. With our current plan, we have spent $6,500 in addition to our monthly premium of $437. We will spend this for the next 2 to 3 years while she undergoes treatment. Even after completing her current 2.5 years of chemotherapy treatment, she's at risk for numerous future complications such as lung, liver, heart, and major organ damage. She's also at higher risk of developing secondary cancers. I'm not asking for a handout. I work hard, I pay income taxes, sales taxes, and property taxes. I think the misconception is that the Affordable Health Care Act only benefits people who are needy, poor, or not working, which is untrue. It guarantees people like my daughter access to affordable health care who otherwise would be denied based on pre-existing health conditions. If the Affordable Care Act is revoked, my daughter will lose access to medical care. She will have to pay out of pocket for her treatment, with costs likely totaling more than $1 million. She will also be discriminated against in the future when applying for future health insurance by being denied or charged more. As a mother, my focus needs to be on Charley and my family, and not distracted with concerns over losing health care coverage or how we will afford it. I want my daughter to live a long, healthy life, and she needs access to health insurance to have that. We called Stephanie, Charley's mom, today to make sure she's doing okay, make sure it was okay to talk about this. She was eager to have her story told. And I'll tell you that the problem I have with this whole process is that I know that folks on the other side will say, don't worry, she'll be covered. But I've heard, again, since the draft of this law was released or declassified, as I said, that hospitals, doctors, and the AARP and other organizations have raised concerns about what access will really be. And that's why I think the process here is really, really wrong, that we should not be rushing this. We should be able to go through a process where we have a CBO score, where we have hearings and testimony from folks who are expressing their concerns about this, the basis for their concerns about the lack of coverage. So we can tell folks like Charley and her mom whether they really will be covered. Because I can't go honestly tell them that they will be. And I don't think anyone in this room can be sure that she'll get health coverage. So I wanted to share that story with you. You can look up Stephanie McMahon. She's a hairdresser. She has a daughter with no hair. She uses the hashtag no hair, don't care. They're a very, very upbeat family going through some tough times, but they deserve to know that Charley's going to be able to afford her treatment